Morning, everyone. Thank you so much for joining us. Today, we're talking about a serious topic that affects millions of people worldwide. Did you know that heart disease is the number one cause of death globally? It's a sobering statistic, but there is hope. For many people, heart disease is actually preventable. We can take steps to reduce the risk of experiencing a catastrophic heart event. Simple lifestyle changes can make a huge difference in protecting our hearts. And that's why we're so glad to chat on IG Live today with Michelle Routhenstein, a cardiology dietitian. During this live, we're going to discuss preventive care for heart health, nutritional deficiencies, and heart disease, salt and its role in our health, and so much more. Oh, hello. Hi, Michelle.
How are you? Good afternoon.
Oh, it's 9 o'clock for me. So
Good morning
it's still early.
to you. Good afternoon to those on the East Coast like I am.
Yep. It's always so awesome to have a fellow dietitian join our Instagram live. So I'm always like super stoked.
Oh yeah, I'm happy to be here. Happy to chat with you today.
Thank you so much for taking the time. But tell us a little bit about yourself and how you became a cardiology dietitian.
Yeah, so I am a registered dietitian and I specialize in cardiovascular disease. And I really came into this because of the prevalence of heart disease. So I was in my rotations, like, in our clinical residency, and you kind of go through all these different rotations, whether it's your kidney rotation, your liver rotation, your weight loss, your ICU, your community, etc. And there was a common theme that no matter what disease state you were in, heart disease was the number one killer and was prevalent, causing heart attacks, heart complications. And I was like, there's something missing here. Because when you look at the research, 80 to 90% of this is preventable. So where's the missing link? Why is it always that is the most prevalent globally if we can actually do something through nutrition and lifestyle to reduce our risk? And so that's when I was like, this is where my calling is because I can have such a big impact. So I niched down into cardiology. And, as a registered dietitian, it's not like when you become an RD, you have a specialty. You kind of have to make it your specialty. So what I did was I worked alongside lipidologists, electrophysiologists, preventative cardiologists, interventional cardiologists, you name it. And I watched them in their medical realm with medication, and I added in the nutrition support. And if you really look at all of the ways that drugs and medication and Western medicine is used, there's a very big component of nutrition here, where there are many nutrients that you need for all of these pathways to work. And so I went to all of the cardiology conferences. I was the only dietitian there. And people will be like, why are you here? Like, this is a drug conference. And I'm like, well, if you actually listen to the details, there's a lot of nutrition focus here too when you have a nutrition background. And so I niched down to cardiology. I've done this for over 13 years, and I love what I do because of the impact it has on people's lives. A lot of people want to see a randomized clinical trial on nutrition and heart disease, and you can't really do that. But the things that I see always impress me. Like, I've had clients who the doctor wanted to put in a stent after a heart attack, but there was too much inflammation. So he said, come back in 3 months and then I'll do the stent procedure. Goes inside and goes, you don't need a stent anymore. Like, you don't see that in research. But to me, seeing that and hearing that, I'm like, whoa, the power of nutrition, right? Or like seeing an ejection fraction go from 15 to 60 with reduction in medication. Like, all of those things are just so impactful. And so I see the benefit of new science-based nutrition on vascular health. And it gives me that passion and joy to continue doing what I'm doing because of the impact it has on so many people's lives.
I mean, one thing you really focus on is preventative. And then I know you also call yourself a preventative cardiology dietitian. So tell us a little bit about it, like the emphasis on preventative.
Yeah. So I was actually going to become a doctor. And in my junior year of NYU, my dad's like, okay, you can't do two tracks. Are you going to do your clinical residency, or are you going to do your clinical residency in nutrition, or are you going to do it, become a doctor? Like, what is your path? And I was shadowing a bunch of different professionals at that time. And I really saw this lack of understanding the preventative arm. When you go to a doctor, they're there to treat disease. They're not there to prevent disease. And so preventative is both in primary and secondary prevention. You can have no disease and you want to prevent having disease. That's what we ideally want to really eradicate heart disease and causing impact long term, right? But individuals get a diagnosis of heart failure. They get a diagnosis of cardiomyopathy. They have coronary artery disease. They have disease already. We can still prevent complications of heart disease. So preventative is really the form of, we can prevent progression. We can prevent complications. And that's why I add in that preventative cardiology arm. We're not here to treat disease. We're here to prevent it from getting worse and prevent it from happening in the first place. So prevention is possible when you're focusing on the natural modalities of nutrition and lifestyle medicine.
Mm-hmm. You actually just answered my next question, because I wanted to ask you, like, why do you think it's so prevalent? So, one is so prevalent in humans, and then second is, why is it so preventable?
So a big part of it is heart disease is silent. You can have heart disease and not know you have heart disease. I can't tell you how many people have come to me being like, I am an athlete, I exercise, I eat clean, I don't eat processed foods. How do I have heart disease? And it goes beyond that. Heart disease can happen in any body shape, any body size, and any athletic ability. So we need to really not be looking at we can't be judging your arteries based on how you look on the outside. And we need to be understanding, well, what are the cardiometabolic risk factors? There's so many times where influencers online will be like, oh, cholesterol doesn't matter, insulin resistance matters. Or they'll be like, oh, only insulin resistance doesn't matter, cholesterol matters. Heart disease can actually show up in many different ways in different people's bodies. And so we need to be doing a more thorough assessment of your cardiometabolic risk factors. We also have to understand that genetic susceptibility of heart disease creates an environment where plaque can form more aggressively. So if someone has a high Lp(a), they might not have very high LDL levels, but they have a lot of atherogenic LDL genetically, especially if they're now adding certain foods in their diet where their body can't digest appropriately. So we need to be taking a step back and really looking at risk assessment for you and being more proactive to actually prevent the silent disease from surfacing. Many times, people will say, I go to my doctor, my blood pressure is high. He tells me it's my anxiety because I'm nervous, white coat syndrome, and that's the end of it. Well, if you actually have hypertension that is not addressed, that can cause a micro tear in the artery wall that causes plaque to form and be more readily creating in there. So we need to be looking at all of your cardiometabolic health. And this encompasses a lot of things, from blood pressure, blood sugar, waist circumference, uric acid levels. And so I think a lot of it is that misunderstanding or misinformation that you might not feel or look at risk, but there's a lot of things surfacing in the background that we need to be more aware of, and we need to be doing more comprehensive assessments. And as I say to everyone on my social media pages, being your own heart health advocate. So you know what questions to ask, what labs to look for, and really taking early intervention to help prevent any complications in the future.
You mentioned about high blood pressure. So, why is it so important to be proactive if you have borderline high blood pressure? Is it because the small tear you just mentioned?
So the small tear is one thing, but think about it. So if your blood pressure is above 120/80, or if your baseline is 90/60, and then all of a sudden you start seeing it creeping up, it means your heart has to work harder to pump blood throughout the body. So your body is resilient. It wants to do everything to keep you alive and to function appropriately. So what happens is that small elevation in blood pressure may not be high enough for the doctor to treat it and say, here, you need medication, but it can cause structural changes in the arterial wall, and it also can cause your heart to enlarge. When we think of heart disease, I think many people just think of atherosclerosis, the plumbing system, right? Getting plaque built up in the arteries. And that's very important and interconnected with the other parts. But you also have an electrical system and you also have a pumping system. And we need to protect all of those systems. So we need to be looking at everything. We need to ensure that there's no chaos in the blood vessel. And chaos can come from blood sugar levels. Chaos can come from inflammation. Chaos can come from atherogenic LDL that is inflammatory. So we really need to be doing a better comprehensive assessment and looking at everything instead of one thing at a time. I mean, this is also why I came into nutrition, because I was working in a kidney clinic that they were giving the opposite of a heart healthy diet. And I wasn't going to let that happen. So what did I do? I revamped the whole system. And I said, this is a heart healthy, kidney healthy diet. Any diet that anyone should be on needs to be heart healthy, because if your heart is not pumping oxygenated blood throughout the body, you are not getting good blood flow to any of your organs. And so I revamped the whole system, and I'm trying to break through this idea of silos, right? There's so many specialties in being in a doctor that you would see, but a lot of times they don't talk to each other, right? So you have your endocrinologist, you have your nephrologist, you have your cardiologist, you have your neurologist, but no one's talking to each other. And we need to be having more of a intertwined and connected, healthcare system. It's kind of like a stroke. Most people who have a stroke, they think it is a brain trauma. They're referred to the neurologist. The cardiologist is like, go to the neurologist. 87% of strokes are ischemic related. They're because of plaque formation that ruptures and causes a blood clot that leads to a stroke. So we need to stop thinking of this in silos and really understanding that we are one body that's all connected, and really looking at that from a good blood flow standpoint.
That makes so much sense. Talking about these risk factors, what about some nutrition deficiencies? Could they also result in cardiovascular issues?
So yes, and it's also multifolded. So what I mean by that is, if you have certain nutrient deficiencies, your heart may not pump, your beat might be off. You might be in AFib, you might be in palpitations. That's one symptom. But if you have heart failure, your needs for certain nutrients are higher. If you're on certain medications like loop diuretics that are causing you to release certain nutrients, you're going to need more of those. So a lot of times it's nutrient deficiencies that may make the heart have to work harder. But then again, it's the fact that if you have heart disease, you need certain nutrients, and then some medications deplete others. So it's actually a very complicated outlook, and that's why we need to be looking at it very comprehensively and personalized, especially if you are on heart medications, because there are a lot of things that have nuances within that.
That makes so much sense. What about supplements? Like which supplement may be beneficial for those who are trying to maintain their heart health? That's like always a question. People always want this magic pill. Like, okay, is there anything that can help me?
So there's actually a recent study that was done about a month ago in JAMA, and it showed that there was 6 to 8 supplements that caused liver damage and kidney damage.
Ouch.
And we have to realize that supplements are not a well-regulated industry. And a lot of times they can do more harm than good. Many people have that mindset, more is better. When I talk about nutrient adequacy for your heart, there is an adequate amount. Too low is not good, and too high is toxic too. And so I think anybody selling a supplement saying everybody needs to be on this is just looking to profit from the billion-dollar supplement industry. It needs to be personalized. I recommend supplements to my clients when needed. And that's based on their medications. It's based on their labs. It's based on their diet. And that's really, really important, because when you just go on a bunch of supplements, you're being marketed to. They're really good at enticing you. This is great for your heart health. Well, of course I'm going to get it. But I'm going to make it very well known that there is no one supplement that everybody needs to be on. If you're deficient in certain nutrients, you may need a temporary supplement. If you are not eating certain food categories that have certain food nutrients in them, you may need supplementation. If you're on medications that decrease and deplete certain nutrients, you may need supplementation. But that needs to be personalized because everybody eats differently, everyone has different labs, and everybody has different medications and medical history that they're on. So please, if you learn anything from this live today, check in with your dietitian, your healthcare team to make sure that it's causing positive impact versus potential negative harm. We need to protect all of your organs. And if you are over consuming supplementation, you're overworking your kidneys and your liver. And guess what? Both of those are really important to help with optimal heart health. And so we need to be protecting them and really focusing on food first.
Yeah, they're all like super interconnected. Many people are under the impression that salt is the enemy, like when it comes to heart health. Is that the case?
So I think that some people take things to extremes. I have a couple of clients. I would say I actually have like a good handful of clients who come to me and be like, I can't eat anything with salt in it. So anything in the package that says more than 0 milligrams of sodium, they don't touch. Well, if you focus so severely on sodium, guess what? You're going to be nutrient deficient. It's like any restricted diet. You focus on calories, you likely are nutrient deficient because you're not focusing on nourishing your body. You don't need no salt. Salt is not the enemy. What you don't want to have a high salt diet that can cause micro tears in the endothelial lining. It could damage your arterial health, but you need to focus more on what are you adding instead of what are you taking away. And that's really important. Kind of look at it like this. High sodium diets can constrict the arteries, increase blood pressure. But there are many nutrients that vasodilate the arteries. So for instance, potassium. I like to juxtapose sodium to potassium. Sodium and potassium work in tandem in the diet. Sodium constricts the arteries, potassium opens them up. So if you focus more on eating more potassium relative to sodium, that has shown to lower blood pressure a lot more effectively. And so we need to be looking at what we're adding versus what we're taking away, but realizing that a little bit of sodium is okay. We don't want to do excessive amounts, but having a little bit is okay. For a reference point, 1 teaspoon of salt is 2,300 milligrams of sodium. So if you're doing a pinch here, pinch there, pinch here, you can get up to 7,000 milligrams of sodium very quickly. So we need to be mindful of that. We don't want a high sodium diet, but we don't need a no salt diet, a no sodium diet. And that distinction is important to be made.
I also really like the aspect of not taking away something, but add something, because that's much more positive than like, taking away. It just like mentally feels like much more negative.
Right. But it's kind of like when people think I'm on a diet, they'll say, I don't eat this, I don't eat that, I don't eat this, I don't eat that. Okay, but what are you eating? If you're taking away those foods, what nutrients are you adding from other foods that will help you become nutrient adequate? And I think a lot of people don't realize that, right? If someone doesn't eat dairy, are they eating enough calcium? Are they having enough probiotics in their diet? You can get it through other food, but are you intentionally planning it into your day? That's an important for us to recognize. And I don't think enough people really look at it that way.
Mm-hmm. Earlier, you mentioned labs. So what kind of tests were labs that should you get to monitor your heart health?
Yep. So there's a whole slew of them. If I had to prioritize it, I would say, let's check your inflammatory markers. So HSCRP, high sensitivity C-reactive protein, is really important to get. And we really want that to be less than the parameter that we're aiming for is less than 1 milligram per deciliter. So that tests for inflammation. We want to be checking for atherogenic LDL cholesterol. So you can do a standard lipid panel and calculate your non-HDL cholesterol. If you have the ability to get an ApoB, it's a direct surrogate marker. It can be a little bit challenging depending on your physician, but I like to see that. I like to see your hemoglobin A1C, your insulin levels to check for blood sugar, insulin resistance, obviously checking your blood pressure at home, especially if you have high readings in the doctor's office, is super, super important. I like to check for uric acid levels. I like to check for homocysteine levels. All of these labs are important because they tell me kind of what's going on and what can we do and what do we need to prioritize when it comes to nutrition.
Are there any other tips that you would recommend for supporting heart health?
I mean, another tip in terms of just like monitoring metrics and taking action is I want you to get a soft measuring tape. And I don't want you to suck in. I don't want you to suck out, preferably in the morning before you eat anything. I want you to check your waist circumference. I can't tell you how many people say to me, oh, yeah, my waist is 35 inches. It's my pant size. They check their waist circumference and like, oh my God, I'm 42 inches. How did that happen? And they have no idea. And this is important because you can do it at home, but it helps us assess for inflammation and insulin resistance. The abdominal weight is where it's most metabolically active. So what happens is these pro-inflammatory cytokines, these proteins, pump out of that adipose, that fat tissue, and we need to target it for cardiometabolic health. So regardless of your weight, I really want to focus on your waist circumference. In the average population, for men, we want it less than 40. For women, we want it less than 35. But in certain ethnicities and in certain risk profiles, we actually want it less than 2 inches from those parameters. We want to make sure that we are really targeting that because it's something that's super, super important from a heart health perspective.
I know for Asians are definitely like a 2 inches like
exactly.
less, same as BMI.
Exactly. And
yeah,
that's because we see heart disease earlier in lower BMIs in these subgroups of the population. I feel like though there's should be more research in other ethnicities because we probably all need to be a little bit into that category. But we know from the research that especially in Asians, we need that number to be much less too.
I know it's like really hard for people to grasp all these. And I also feel that obviously not all the doctors and not even all the dietitians are equipped with this breadth of knowledge that you have. So how can someone work with you if they just like, hey, I want to work with Dr. M? Like, how do I work with you?
So I'm happy to help in any way that I can. I have group programs. I have one-on-one programs. I welcome you to kind of browse my website, entirelynourished.com. You can sign up to my email list where I give a lot of heart disease prevention tips. And I have a tab on my one-on-one services and my group coaching. I'm 100% virtual. Before COVID, I actually had 0% virtual practice. I had my office in Manhattan and I was just working alongside all these cardiologists. COVID happened, and then I moved to a virtual model, and everybody, even my clients in the city were like, Zoom is so much easier. So I do everything over Zoom these days. And, if you have any questions, you can also contact me on my contact form on my website. I'm always happy to answer those questions too.
This is amazing. Thank you so much for sharing your knowledge. This is just incredible. I think we're going to have to invite you back and talk more specific details on heart health.
Yeah. Happy to. Thank you so much for having me. And for those of you who didn't watch this from the beginning, we'll have this on both of our pages for an IG, so you can look through it there and hope it was helpful and that you take an empowered approach in your heart health wherever you are in your journey.
Absolutely. Thank you so much. And then have a great rest of your day.
You too. Thanks so much. Bye. Be well.
Bye. Bye.